Hi, I'm Dr. Aparna Ramakrishnan, consultant psychiatrist, Kokilaben Dhirubhai Ambani Hospital, Andheri. And today, I want to discuss with you about post-traumatic stress disorder or PTSD. It's a mental health condition which can be triggered in some people when they are exposed to or when they witness a significantly traumatic event. A traumatic event is any event which can cause harm to the person, or it can even threaten the sense of safety, security and the very existence of that particular person or his or her loved one. Some examples include accidents, sudden injury, sudden illnesses, wars, combats, natural disasters like floods and earthquakes, abuse, whether it's physical, emotional, sexual, occurring once or occurring over a period of time, or even the sudden death of a loved one. In fact, 3 to 5% of people who are exposed to such traumatic events go on to develop PTSD, and it is seen more frequently among women as compared to men. Now, how do we identify post-traumatic stress disorder? The symptoms vary from person to person. Symptoms vary over a period of time. However, usually they start about within 1 month of the traumatic event itself. Some of the most common features which are seen are, first of all, intrusive memories, which are repeated, distressing, painful memories of the traumatic event, nightmares about them, flashbacks which are very real and vivid. ऐसा लगता है that you are actually reliving the event over and over again, and physical and emotional reactions to anything जो आपको उस event की याद दिलाता है. And then of course we have avoidance. We avoid anything, whether it's people, places, activities, situations which remind us of the traumatic event. And there is also avoidance of talking about it, expressing your feelings about it, or even processing it itself. This is often accompanied by changes in mood, changes in thinking, constant negative thoughts, not able to feel any positive emotions, feeling helpless, hopeless about the future, feeling scared, feeling angry, feeling guilty, feeling ashamed, or sometimes even feeling emotionally numb, completely detached from the surroundings, not feeling interested in any of the things that you used to enjoy before. And of course, this is accompanied by physical and emotional reactions like increased startling, hypervigilance, not able to sleep properly, not able to eat properly, getting irritated very, very quickly, anger outbursts, aggression, not able to focus, and often self-destructive and reckless behavior. Now, what does the management of PTSD consist of? The key to managing post-traumatic stress disorder is therapy. Therapy as well as counseling. Now, the most commonly used therapy over here is cognitive behavior therapy or cognitive reprocessing therapy, where we work upon all the negative emotions like fear, shame, guilt associated with it. Also the beliefs which are associated with the traumatic event. Then there is another form of therapy known as EMDR or eye movement desensitization and reprocessing therapy. Another technique that works very well is group therapy. Here the survivors get a safe, comfortable, non-judgmental environment to talk about their trauma and to process it in a very healthy manner. Family therapy is also important because this is something that not just affects the individual, it affects the entire family. Of course, there are anti-anxiety medications, antidepressive medications which can also be used in case of PTSD. Now, how do we prevent PTSD? Actually, there are so many times when the traumatic event cannot be prevented, but we can help the patient or we can help the person from developing PTSD itself. First of all, reach out. Reach out to your loved ones. Seek support of mental health professionals, especially if you've undergone something extremely traumatic. Join a support group. At the same time, practice the healthy coping strategies which you have learned over a period of time. And finally, whatever you have done to face this particular event, you have survived. So try to make something positive out of the way you have acted during this particular event, which has helped you survive the event. These are some of the techniques which may help us from preventing the development of PTSD after exposure to trauma. Thank you.